Hello there. Now Dr. Brownhilda Santoron come again. So we'll continue that. We'll talk on chronic cough. For that part one video, we talk about some of the diseases and conditions the way if you make and you get chronic cough. For the part two, we'll go focus more on the treatment and some measures and way if you take and for prevent you from getting the chronic cough. We will talk about four main conditions where if you make and we get chronic cough for that part one video. Number one may be na upper airway cough syndrome or postnasal drip. Number two may be na gastroesophageal reflux disease or GERD or acid reflux. Number three may be na cough variant asthma or even just asthma. And number four may be na medications them. There's so many other things in the way they fit cause chronic cough, but I'm not going to talk about them because it be beyond the scope of this presentation. So we'll start by talking about each one of them and then talk about what we'll do them for prevent that condition or for help that condition. So before we start talk about the treatment and some of the measures then, I want to advise anybody where you get chronic cough, say may go see a doctor. I will talk a little bit more about the treatment, not because I want to say more I just go buy the medication and start using them on our own, but now because say if you get any healthcare providers, the way they listen to me, if you also help them, give them some direction, because actually one of my specialties them now I be a lung specialist also among my other specialties them. So I will want to go a little bit in depth for help even other providers them. So we'll start with the postnasal drip or upper airway cough syndrome. Remember say I be talk say it cause drainage in the back of your throat. If you use nasal sprays them, the nasal sprays they come in different types them. So nasal spray they were na steroid nasal spray because steroids be important for cause for help for decreased inflammation, especially for people then way that they get drainage and that they also get stuffy nose where they feel like say be congested. That's steroids if it help. If you also use the antihistaminic nasal spray, when a nasal spray way it help with allergies them. So other nasal spray they when nasal spray will help for dry you up, and I go put example them for up mona siam. This one way they help you for just dry you up, the bookman they call and say anticholinergic nasal spray. So these nasal sprays and the fee help una. Also, you feel also use what they call and say nasal rinse. Nasal rinse they so if you make your own nasal rinse or if you buy them for pharmacy. For make it be simple, you get salt and you get if you get baking soda if you make them, you take 3 teaspoons of salt, mix and 1 teaspoon of baking soda, and then when you don't mix and now you take 1 teaspoon of that mixture, and then now you add that 1 teaspoon now for inside 1 cup of water, maybe na sterile water or if you boil the water then leave and make it cool down and then you put them for day. When you do and so you take this bob then where I go show now for up. We used to use them for small picking them. Now remember, mommy they fit use that bob way when they want move kata for picking in nose where you know fit blow in nose. That same bob if you use them, you remove take that water there, then you squat it inside your nostrils, put your head for down so make it wash them out. And if you use other methods them, I will put other methods I wanna see where these people they use them. So other containers them, anything if you go into your nostrils where it will help you for wash out the nostril if you use them. The whole purpose now say waiting, now say make it remove any of those particles them or dust or any chemicals or anything where it help for irritate your passage and also for cause inflammation and hence coughing. When I remember, say I be also talking to some people the way they get this coughing and this drainage, they also get sneezing, itchy eyes, itchy throat. When are all symptoms the way it shows say you get allergies. So they feel also give you allergy pills them. Different types and day. You get loratadine, cetirizine, fexofenadine, an example in this for up. So and depending on which way they for the part of the world where when I live in, your doctor fee give you one of these medications the way they call and say antihistaminic medication them. Another allergy medication the way it belong to a different class where they fee give you the name na Montelukast. It help also with allergies and the drainage. And even for some people they get asthma, especially if the asthma being from allergy, that medication too if it help. Now example this for the medication for up. We talk say number 2 condition where if it cause you for get chronic cough na GERD, that gastroesophageal reflux disease or acid reflux. So what will be some of the measures and where if you take them for avoid or prevent this acid reflux? You get for avoid some of the triggers them. Example, spicy food, chocolate, cigarette smoking, caffeine, fried food, tomato-based food or tomatoes, or anything where if it cause you for get acid reflux. For some people, then they so alcohol too, it provoke them. Anything where you don't realize and say they make you get heartburn, you get for stop for either take that thing or for use that thing. Also, because the acid reflux will be worse when you lay down and you lay flat, you feel actually when you sleep, you elevate your head. Some people they even put like bricks under their mattress or put more pillows them when you sleep so that your head feel be elevated. Also, it be advisable say may not just chop, go immediately to bed. After you chop, wait for about 3 to 4 hours before you go to bed so that it will give enough time for that chop for digest and less chance to say the chop go reflux into your esophagus, your food pipe when you lay flat. Certain medications and the way your doctor will give you for help you with this acid reflux. I will put examples them for up. Certain supplement and the way una fit take away if it help una. These include licorice or even combination for glutamine, aloe and licorice, and I'll put them for up here more and see the example for this medication there or these supplements them. If you also take probiotic, especially the one where it contain lactobacilli and bifidobacteria, if you take this probiotic them, it will help also. Some people then also fit take magnesium. In fact, magnesium being a part of the ingredient for a lot of that antacid and GERD medications the way they be out there. If you also take zinc carnosine, an example now wait till I'll show now for up also. If you also use digestive enzymes like this one. We'll be talking number 3 disease or condition where if it cause chronic cough na asthma. So for asthma, I will talk more about them for a different presentation. But what we will need for know na say you need to take the medication the way it cause the asthma. Your doctor it will determine if you get an asthma based on your other symptoms then. Some people that will asthma, they will get wheezing, they feel get chest tightness. Sometimes there's a family history of asthma there, so they will suspect say maybe a chronic cough now from asthma. With asthma, they give you some medications the way na inhalers them, puffers them. I go put example them for up more and see them. And if it be different types them, if you get the one that they call say emergency inhaler when na albuterol, rescue inhaler, where you take 2 puffs every 4 to 6 hours as you need it, meaning that when you get that episode and for cough and chest tightness and wheezing, you use them. Sometimes you go need more than just that albuterol. You go need albuterol combined with inhaled steroids. They get 2 functions. That inhaled steroid, it help for decrease inflammation where it cause you for cough. And the albuterol, it help you for bronchodilate, for open up your windpipe, for help you may the cough over. Some people then feel be only for that inhaled steroid alone, or if he be for the combination of inhaled steroid and albuterol, or you need just that albuterol. So your doctor will determine what way you need depending on how bad your symptoms and day. So you get for treat that asthma. Also, if you get nasal drainage and you get acid reflux, those 2 things then they will make your asthma symptoms then worse. So if you get drainage and you get reflux, then they get for address them in order for control your asthma symptoms then. What to be number 4 condition what we talk say if it cause you for cough. We talk about medications then. So if you there for any of that medications the way they call and say angiotensin converting enzyme inhibitors like lisinopril, enalapril, captopril, quinapril, and some other ones that they end up with pril. When example then this for up, then your doctor will stop that medication. Now medication then way they use them for blood pressure and for heart. So your doctor will determine which way it cause your cough, and then if you stop them. In fact, when you get chronic cough and you're on one of those medications, then sometimes they so by stopping that medication, if you actually make your cough go away. However, it be also important for know say when you stop the medication, the cough not just disappear immediately. Sometimes for some people, they even take weeks and few months for completely go away. And this medication, they so some person even be for the medication for so long time, they fine, and then all of a sudden it start cough. Or they even increase your dose of the medication, then you start cough. But the take home message now say waiting. If you're there on one of these medication there and you get that chronic cough, your doctor get for pay attention to the fact say you're there on that medication. You too even look out amongst your medication there. If you're there on that medication and you get chronic cough, ask your doctor whether or not this medication fit the cause. And if not the medication, then they will get for change and give you different medication. So for that part 1 video, we talk about some of the conditions where if it cause you forget cough. And for this part 2, we don't talk about some of the treatment and measures and way if you take them for prevent cough. I hope say we don't get a lot out of this presentation them. I also want say more na share this knowledge with other people them. So una share, una subscribe, una like, una comment. And if you get medical practitioners the way they listen to me, una also share and una patients them. Una remember say knowledge is power and health is wealth. Thank you very much. Dr. Brownhilda Santo.